Text: Motion Analysis Laboratory. Division of Physical Therapy. A patient is strapped into a rig with ping-pong balls around his body, and balances on one foot while he's viewed through a monitor.
A motion analysis laboratory is a term that we use to refer to a room or space that is dedicated to collect and process movement data.
Text: Victor Santamaria, Ph.D., MSc, PT, Pieces, Assistant Professor, Physical Therapy.
I'm Dr. Santamaria, and I'm an Assistant Professor of Physical Therapy at NYMC.
He navigates around a 3D environment on a computer with dots mapped in 3D space.
One of the gold standard measurements in motion analysis lab is the use of infrared cameras.
Flashing lights on cameras mounted to a metal beam in the lab face the rig.
For example, we have a Vicon system of 8 cameras, and they detect the movement of reflecting markers.
Waveforms on a computer screen.
And then we stick those markers on anatomical landmarks that then later we can use in the software to recreate a link model. And from there, we can compute and analyze the data.
The subject leaps in place. The dots mapped in 3D space repeat his motion in the 3D environment.
We also have like force plates that we can use to kind of like compute the forces that the body exerts on the ground.
A second harness is strapped to his waist.
And then we can estimate postural balance, for example. And then we use electromyography, or EMG in short.
A bank of lit tubes in a case with cables beside the rig.
Those are sensors that we use to register muscle activity. An advantage of having our motion analysis laboratory here at NYMC and within this clinical network is that we can use the lab for education purposes, so our doctor and physical therapy students can learn about the movement, visualize and fully understand it here with all the equipment that we use for research purposes, but also we will be bringing people with different disabilities. So the ultimate goal will be to improve the quality of life of people, children and adults who live with motor disabilities.
He holds a ball out and the man reaches for it. Later the man repeats his motion of balancing with his arms outstretched. Both motions are replicated by the markers in the 3D space.
I honestly would like to see in 3 or 5 years the development of research collaborations. I would like to collaborate in this lab with professionals from different areas and disciplines, and even with researchers within this institution or from different institutions. Because from my humble experience, I can tell you that interdisciplinary collaborations make a big impact on health.
Text: New York Medical College. Chartered 1860. A member of Touro University.